The Chief Medical Director of the Lagos University Teaching Hospital, LUTH, Mr. Chris Bode, says 4 wards in the newly rehabilitated Block B section of the hospital have been converted to an isolation center to admit and treat COVID-19 patients.
We have been able to put together a newly furnished block of 4 wards, each one containing 30 beds. We have 60 beds altogether now, new beds, and we have enough personal protective equipment and all what we need, a lot of what we need to start admission of COVID-19 positive patients in Lagos. As you heard, this will still be done through the pyramidal structure of Lagos State. We will be operating under the command of the Lagos State government, because we don't want to be doing anything parallel to the arrangement that's already on ground. It will be to complement what's already going on. So we are very happy with that. We have a squad of 120 staff, all volunteer staff that are ready as warriors to combat this condition in LUTH. They've all been trained. We have about 30 doctors, about 30 nurses, we have cleaners, we have drivers, we have security men, we have laboratory scientists, pharmacists, psychiatrists, you name it. It's a team, and they have all willingly come together. They've been training since February, and we are ready to combat this disease.
Well, let's dissect the coronavirus pandemic in Nigeria. And joining us is the United Nations Population Fund resident representative in the country, Ms. Yula Mueller. She joins us via Skype from Abuja. Thank you for joining us at this time. First, how are you coping with the stay-at-home order and social distancing measures, seeing as Abuja is one of the high-burden areas to curbing the spread of the virus?
Well, good evening, and thank you very much for having me here. And thank you for asking how I'm coping. I think we're coping very well at the UN. We are practicing very good hand hygiene, social distancing, and if you saw us yesterday with the Presidential Task Force and the launch of our basket, you'd also see that we did adhere to the guidelines. So we're coping well, and we are very pleased with the way that we are collaborating with the government. So I think things are on the right track.
Now, many countries classified as high income have struggled to curb the pandemic. Are you worried that perhaps Nigeria might be struggling?
I think all countries are struggling. I don't think it would be reflecting justice on any country and say they'll be struggling. All countries will, and I think the government here also recognized it's a weak health system. However, and that's where UNFPA fits in the one UN approach, is that I recently spoke to the Minister of Health, and he recognizes the need for maintaining essential health services, and that's to avoid, an indirect mortality, because it's going to be a challenge also in Nigeria, and that's where UNFPA comes in. So we are supporting maintaining essential health services, in particular, of course, reproductive health and safe deliveries, and a response to gender-based violence.
Oh, Ms. Mueller, I'd like to ask you your thoughts on the French experts we hear, French scientists, who suggested that Africa be the center of testing the vaccine for COVID-19. A lot of people have said rather disgraceful comments there. What do you make of such comments?
I would rather not pass judgment. I think there's a lot of speculation, a lot of comments, and some of them also just comes from not having full knowledge. So I think instead of having and commenting on specifics, I would just really encourage people to, stick to the facts. Even though it's difficult, let's not let emotions take over, but look at what we know about COVID, how we can prevent it, and how we can beat it. And let's not stop at speculations, because that defer our attention for a very important task ahead of us.
All right, Ms. Yula Mueller, United Nations Population Fund resident representative in Nigeria. Thank you for joining us at this time.
You're most welcome. Thank you.
The leadership of the National Assembly has met with the Minister of Humanitarian Affairs, Disaster Management and Social Development on efforts by the federal government to mitigating the effects of the COVID-19 lockdown in some states. At the meeting, the President of Senate called for a review of the strategy used in the social investment program, highlighting the problem with identifying the poor and vulnerable in the society, as he believes that they have not been reached sufficiently across the country. And starting from today, it will be an offense not to wear the face mask in Edo State, and anyone who flouts this directive will be prosecuted. The Deputy Governor of the state, Mr. Philip Shaibu, at a press conference in Benin City, also ordered the closure of all markets and the relocation of food markets to schools and some designated centers.
All markets in Edo State are to be shut down, effect from Tuesday, 12 midnight. And the state government will be taking advantage of the closure of the market to start fumigation from Wednesday, 8 April this month. And the market are to be relocated to designated public primary schools and secondary schools within the market vicinity. The purpose is to, we have proved that foodstuffs and other essential commodity are the only one allowed to be to operate in Edo State. The government also has mandated the use of face masks, as government will sanction and prosecute anybody that is not adhering to this directive.
In Ekiti State, the governor, Dr. Kaide Fayemi, has called off the no movement order for only Tuesday and Thursday. His reason is to allow people restock for the Holy Week, and barring any other circumstance, the no movement order resumes on Friday. In Kaduna State, the government relaxed the 24-hour curfew it imposed across the state for 2 days, beginning from Tuesday to midnight of Wednesday. The state government had on March the 26th imposed a curfew as part of measures to contain the spread of COVID-19, which already has 5 confirmed cases. With this latest development, residents have tripped to various markets to purchase foodstuffs and other essentials, many of them saying the temporary relief will come in handy. In the meantime, 2 pastors have been arrested and arraigned at a Kaduna State Chief Magistrate Court for holding church service last Sunday at Sabon-Tasha area of Chukun local government area. This is against the lockdown imposed by the state government. The State Commissioner of Internal Security and Home Affairs, Mrs. Samuel Arunwa, said the 2 clergymen were arraigned on a 2-count charge of criminal conspiracy and disobedience to a legitimate order under sections 59, 115 of the Penal Code of Kaduna State. While in Ogun State, southwest Nigeria, the government relaxed the stay-at-home directive for 6 hours today to allow residents to restock their basic needs. The window of opportunity was open between 7 a.m. and 2 p.m. when residents are expected to put in place some more measures to ensure that they stay safe at home. Still talking about more of the measures to curbing COVID-19. Joining us in our studio here in Lagos is Dr. Tony Adeyemi, a public health physician. Thank you for joining us at this time.
Thank you for having me.
So we've had you here before, looking at then and now. What's your take on our efforts so far in flattening the curve?
Between then and now, when I came initially, that was when we first started the lockdown phase. However, these days we are seeing that people are not complying with this lockdown order. It has actually been relaxed a bit. On social media, we've been seeing photos that have gone viral of people coming out on the expressway to exercise. It's like they do not understand the essence of the lockdown or social distancing. Social distancing does not mean go stay away from work, go home and do other things. It means stay at home with your nuclear family, because the more you interact with another family member from somewhere else, he might have the virus and be asymptomatic and you might not know. Others in your family might be observing social distancing, but you who have decided to go out could actually bring this into the house, into the household. So we're employing people right now. please, even if the military personnel have reduced on the road, it's your own responsibility, and it's a responsibility to your own household to ensure that you observe all the social distancing measures.
For the healthcare workers celebrating World Health Day today, paint a picture of some of the risks they're exposed to this period.
Okay, healthcare workers, even of recent now, we've been hearing of cases of travelers who have traveled and come back and did not disclose their travel history to these health workers. PPEs are not, that's the personal protective equipment. They are not, we don't have them in abundance, so we prioritize. There's a protocol for when to use a PPE. You use a PPE only when you have a suspected case based on either history of travel and all. So these healthcare workers are usually not fully kitted when they see a new patient. And if you now hide your travel history, you're not a suspected case and you put everybody at risk. And that's what we're having. We're seeing a lot of that in different states in Nigeria. The trend is getting higher. People are, I don't know if it's that they don't trust the system, but they don't disclose their travel history. And this is very dangerous and hazardous to the healthcare workers.
So some people are reporting being refused routine treatment this period. Do you think there is a danger that this might affect other people with other ailments, but maybe symptoms that are close to COVID-19?
It's actually a possibility, but I'm aware that hospitals at the different levels of care, the primary, secondary, and tertiary level, they've put in place measures to attend to other cases that are not COVID-19 related. For example, now, those on TB medications, because tuberculosis is a major thing in Nigeria, and we cannot afford to have them off their medications. So we've given them long appointments. Initially, you come to the hospital like every month or every 2 months to come and get your drugs, but now they're giving them drugs for 6 months to last them at home. Emergency rooms are open at the various levels of care, so they can actually walk in there. But outpatient cases, cold cases, cases that are not emergency, there are other methods that have been put in place for you to connect with your healthcare provider, and they would actually let you know if to come into the hospital or not, because coming to the hospital can also put you as a patient at a higher risk of contracting COVID-19.
All right, we'd like to appreciate your time, Dr. Tony Adeyemi.
Thank you for having me once again.
Thank you for joining us. Well, let's look at the figures coming in today. Across Africa, there are now more than 10,000 confirmed COVID-19 infections and 491 deaths. The 5 African countries with the most confirmed cases are South Africa, is over 1,500, Egypt with over 1,200, followed by Algeria in 3rd place. Morocco has over 1,000, and Cameroon 658. The country with most fatalities is Algeria. Meanwhile, at least over 1,000 people have recovered from the virus on the continent. In the meantime, Nigeria's President Muhammadu Buhari is wishing Prime Minister Boris Johnson a quick recovery and restoration to full health. In a statement by the Senior Special Assistant on Media and Publicity, Mr. Garba Shehu, the President's sympathy and solidarity are with the British leader as he battles COVID-19 personally, and with the British people as their country battles the devastating effect of the pandemic. Meanwhile, as the coronavirus spreads, more countries are taking stringent measures to curbing the spread. Well, we'll bring you that report later on. But let's perhaps take you to what the NCDC looks like at this time, talking about protecting the health of Nigerians. The Nigeria Center for Disease Control, its website has all the information and statistics on the cases across states in the country. It also has regular updates on COVID-19 regulations, several guidelines on how to effectively self-isolate and what it means by social distancing. You can also access emergency contacts as well if you need to. Over at the World Health Organization is a live feed of the pandemic, talking about the different cases, the recovery efforts across board. You also have several frequently asked questions answered there. The World Health is maintaining that the risk assessment is a level of very high. Well, let's take you to the global update on the coronavirus pandemic.
Moroccans who venture outside their homes without wearing face masks now risk prison sentences of up to 3 months and a fine of up to $126. The new order is for those allowed to go out during the coronavirus pandemic. Morocco is under a month-long public health state of emergency that started on March 19 and has so far reported 1,120 coronavirus cases and 80 deaths. Meanwhile, the head of the World Health Organization is condemned as racist. The comments by two French doctors who suggested a vaccine for the coronavirus could be tested in Africa.
To be honest, I was so appalled. Africa cannot and will not be a testing ground for any vaccine. WHO will not allow this to happen.
Over in the UK, there's only one thing dominating the headlines. Prime Minister Boris Johnson has spent the night in intensive care at a central London hospital after his coronavirus symptoms worsened. According to authorities, the 55-year-old has been given oxygen but has not been put on a ventilator. And finally, it's good news for China as the country has reported no coronavirus deaths, the first time since it started publishing daily figures in January. The National Health Commission said it had 32 confirmed cases, down from 39 on Monday. All of the confirmed cases on Tuesday had arrived from overseas.
Well, that's it on the program. Finally, we'd like to thank all the health workers, especially those leading the fight in the COVID-19 pandemic. We have another update on the COVID-19 pandemic at 9 p.m. Join us then. I'm Millicent Walker. Bye for now.